Exercise always leads to extra energy expenditure, and glucose is always a contributor. In people without diabetes, the fuels used to meet this increased energy demand are regulated automatically. But as we've seen in previous modules, when you have type 1 diabetes, there are lots of different things to consider when attempting to regulate the use of body fuel stores. Even with advanced blood glucose monitoring and insulin delivery devices, this can sometimes feel like you're trying to paint a single pinstripe with a monster paintbrush. The key objective around exercise is trying to achieve an effective ratio between insulin and the body's counter-regulatory hormones. These include glucagon, cortisol, growth hormone, and the catecholamines, or stress hormones. Even with appropriate adjustment of injected or pumped insulin, the most common acute problem for people with type 1 diabetes during exercise is getting caught out with too much relative active insulin on board. This is mainly because the effects of insulin adjustment are never realised immediately. All exercise consumes extra energy, and as I explained in the basic physiology module, the body produces energy for exercise primarily by breaking down glucose and fat. I called this the energy mix. I also use the term X-carbs to represent the overall carbohydrate portion of the exercise energy mix. X-carbs represents the sum of the muscle glycogen plus liver glycogen plus blood glucose used to fuel exercise.